UK paid $20 million for new coronavirus tests. They didn't work. Facing a global scramble for materials, British officials bought millions of unproven kits from China in a gamble that became an embarrassment. London. The two Chinese companies were offering a risky proposition: 2 million home test kits said to detect antibodies for the coronavirus for at least $20 million, take it or leave it. The asking price was high, the technology was unproven and the money had to be paid up front. And the buyer would be required to pick up the crate loads of test kits from a facility in China. Yet British officials took the deal. According to a senior civil servant involved, then confidently promised tests would be available at pharmacies in as little as 2 weeks. As simple as a pregnancy test, gushed Prime Minister Boris Johnson. It has the potential to be a total game changer. There was one problem, however. The tests did not work. Found to be insufficiently accurate by a laboratory at Oxford University, 500,000 of the tests are now gathering dust in storage. Another 1.5 million bought at a similar price from other sources have also gone unused. The fiasco has left embarrassed British officials scrambling to get back at least some of the money. They might perhaps have slightly jumped the gun, said Professor Peter Openshaw of Imperial College London, a member of the government's new and emerging respiratory virus threats advisory group. There is a huge pressure on politicians to come out and say things that are positive. A spokesperson from the Department of Health and Social Care said that the government had ordered the smallest number of tests allowed by the sellers and that it would try to recover the money, without specifying how. The ill-starred purchases are in some ways a parable of the risks in the escalating scrum among competing governments racing for an edge in the fight against the pandemic. The still emerging tests for antibodies formed in response to the virus are the next stage in the battle. By enabling public health officials to assess where the disease has spread and who might have some immunity, widespread use of the tests is seen as a critical step in determining how and when to lift the lockdowns currently paralyzing societies and economies in much of the world. You can't lift the lockdown as long as you are not testing massively, said Nicholas Locker, a professor of virology at the University of Surrey. As long as the government is not testing in the community, we are going to be on lockdown. The gamble on the Chinese antibody test, though, is also a barometer of the desperation British officials felt as public pressure has mounted over their slow response to the virus. One prominent expert, Jeremy Farrar, the head of the Wellcome Trust, a British non-profit that is a major funder of medical research, recently warned that the UK is likely to be certainly one of the worst, if not the worst affected country in Europe. Long before the development of an antibody test, Germany, for example, the continent's leader in containing the virus, began conducting as many as 50,000 diagnostic tests a day to help trace and isolate cases. That rate is now nearly 120,000 a day. As of Wednesday, Britain was still conducting less than 20,000 diagnostic tests a day. Having missed a previous target of 25,000 diagnostic tests a day by the middle of April, officials are now promising to reach 100,000 a day by the end of the month and as many as 250,000 a day soon after that. British officials have said that they started out behind because they lack major private testing companies of the sort found in Germany and the United States, which are capable of manufacturing and performing tens of thousands of diagnostic tests. But by the time Britain began pushing in earnest to expand its capacity, it was also trailing behind most of Europe in the competition to buy up the limited supply of compounds, tubes and even swabs needed for diagnostic tests to determine a current infection with the virus.